Rise to inform the members of the status of the pro-life amendment on the bill today. Last night there were lots of negotiations. There were a couple of compromises discussed. I went with my colleagues, Bart Stupak, Chris Smith, Marcy Kaptur, Kathy Dahlkemper, before the Rules Committee after midnight. The final outcome is this. There will be only one pro-life amendment offered on the floor today. It will be the Stupak, Ellsworth, Pitts, Smith, Kaptur, Dahlkemper amendment that will prevent federal funds from funding abortions in both the public plan or with affordability credits. It just codifies the Hyde Amendment for the two new programs. This actually preserves the status quo of our law today. No federal government funding for abortions, just like SCHIP, Medicaid, DOD, FEH, BP, Indian Health. This is a bipartisan amendment. The pro-life groups, National Right to Life, Catholic bishops, family groups all support this. I urge the members to support this amendment when it comes to the floor today. Thank you.
For what purpose does the gentleman from Virginia rise?
To address the House for 1 minute to revise and extend my remarks.
The gentleman is recognized for 1 minute.
Mr. Speaker, we are a great nation, a prosperous and compassionate one, but our health care system doesn't measure up to that greatness. And in fact, we pay nearly half of what we pay twice what every other industrialized nation pays. And yet 71 nations have enabled their people to live longer and healthier lives. The difference is that they have decided that the health of their people is a higher priority than the profit of their insurance companies. And, Mr. Speaker, we today will have the opportunity to bring our health care system up to a standard deserving of the greatness of this nation. By controlling our costs, by covering all of our people, and by improving the quality of the care that they receive. This bill is deserving of the greatness of our nation. It must pass today. Thank you, Mr. Speaker.
For what purpose does the gentlelady from North Carolina rise?
Permission to address the House for 1 minute, Mr. Speaker.
The gentlelady is recognized for 1 minute.
Thank you, Mr. Speaker. Despite months of town hall meetings and after millions of Americans voiced their opposition to a government takeover of health care, Democrats in Congress are moving ahead anyway. Not only does the Pelosi health care plan raise taxes and increase spending, it will vastly grow the size and power of the federal government, taking more and more of our freedoms away. The Pelosi health care plan proposes the creation of more than 110 new bureaucracies, boards, commissions, or programs. More taxes, more spending, and more government is not the plan for reform the people support. Republicans have a plan that allows us to keep our freedoms and not be dictated to by the federal government. It's the right prescription for health care reform. I yield back.
For what purpose does the gentleman from New Jersey rise?
Address the House for 1 minute, revise and extend.
The gentleman is recognized for 1 minute.
Mr. Speaker, the American people are counting on us to reform this broken health care system. Health insurance premiums and out-of-pocket costs have risen steadily, and the number of families in trouble over health care continues to grow. 48 million uninsured, 50 million underinsured. We simply cannot afford to maintain the status quo. Those who continue to resist a much-needed change in our health care system are refusing to deal with the problems, and they won't go away if we ignore them. The health care insurance reforms we are espousing will benefit Americans, including those who are already enrolled. No longer will coverage be denied or hikes go for pre-existing conditions. Insurance companies will no longer be able to drop insurance when a policyholder becomes sick, just when a patient needs insurance the most. There will be a positive emphasis on prevention with vaccinations, mammograms, and colonoscopies that will be covered with no out-of-pocket expenses. In addition, there will be lower premiums for millions of older Americans who will see the donut hole go away. I urge my colleagues to do the right thing and vote for this bill.
For what purpose does the gentleman from Louisiana rise? The gentleman is recognized for 1 minute.
Thank you, Mr. Speaker. Today is the showdown on a government takeover of health care. And while there are still deals being cut to try to round up the last few votes in dark of night behind these closed doors, what the American people have said is they want transparency and they don't want a government takeover of health care. The American people want to fix the problems that are broke, like we do in the Republican alternative we'll be presenting, that actually lowers costs. CBO score says 10% reduction in health care premiums, addresses pre-existing conditions, and yes, we actually do real medical liability reform to lower the cost of health care and stop all of these tests that are run just for defensive medicine purposes. Now, just a little while ago, one of my friends on the Democratic side said that he wants to redefine freedom. Well, with all due respect, I think the Founding Fathers got it right. And we don't need to go and rewrite freedom and have a government takeover of health care. Let's fix what's broken, but don't break all the things that make medical care work so well for many Americans in this country. I yield back.